Swallowed objects. Sometimes people by mistake tend to swallow objects that are harmful. However, infants and toddlers have a natural curiosity and tendency to put things in their mouth, which puts them at a higher risk than the adults. Most of the objects they swallow are not harmful and are passed through the digestive system and out with the fecus without any problem. But sometimes the swallowed objects get stuck in the esophagus or the food pipe and may not be able to pass through the stomach. In that case, a doctor will have to remove the object. Signs and symptoms. The symptoms of swallowed foreign object are usually hard to miss. You'll notice symptoms immediately if the object blocks the airway. The most common symptoms include choking, breathing difficulty, coughing, wheezing, vomiting sensation, and stomach pain. An item stuck for a long time in the body with no treatment can cause infection, such as recurrent aspiration pneumonia. This may result in chest pain, wheezing, and fever at times. Treatment. Occasionally, the swallowed object can become stuck in the esophagus, stomach, or intestine. If you suspect any of the symptoms, seek medical assistance by a doctor. If experiencing cough or having difficulty breathing, the object may be in the airway or lungs. Therefore, calling an ambulance and seeking immediate assistance would be better. Pointed objects could puncture the esophagus or bowels. Small batteries, such as watch battery, can cause tissue damage. These items should be removed immediately. Seek medical assistance immediately if these conditions are seen. Medical treatments. In hospital, a doctor or nurse will ask what the person has swallowed. An X-ray may be done if the swallowed object is made up of material that shows up on an X-ray, or if the person has worrying symptoms. If the person can barely breathe due to blocked airway, emergency treatment is usually necessary. The foreign object may be removed from the airway using back blows, the Helmish maneuver, or CPR. If the person isn't choking on the foreign object and seems to have swallowed it completely, a doctor may decide to wait and see if the body passes the item normally. You may need to watch for the symptoms such as vomiting, fever, or signs of pain. The doctor might also ask you to check the stools to make sure the object left the body within 1 or 2 days. In case the foreign object is causing pain or damage to the bowels or the esophagus, your doctor will likely treat the issue right away. This may call for a surgery or an endoscopy to remove the object without puncturing the bowel or esophagus. An endoscopy uses a small tube with a camera and tiny surgical instruments. A doctor will insert it into your mouth and down the esophagus to remove the foreign object. How can we prevent someone from swallowing objects? You can prevent this issue by keeping small objects out of reach of infants and toddlers. Avoid putting small foreign objects in your mouth, especially items that can slip down your throat and block your airway. Remember, anyone can accidentally swallow a foreign object.